For those that don't know me, my name is Dale Fraser. I'm the Chief Executive Officer of Grampians Health, and it's my very great pleasure to be with you today. Before we commence, just some very minor housekeeping. We have an online audience today, just over here to my right on the screen. Hello, everybody. If you are having issues on the online screen, please just respond in the chat function, and Ava will certainly look after you to your audio-visual concerns. This live event, for those online, does not include a Q&A. If you have feedback for us, please use our various contacts sections on our websites, or speak to one of the numerous board directors or executive staff here today if you're in the room. We'd be delighted to speak to you about the fantastic services that Grampians Health has, and anybody's ideas for improvement. Just make sure that everybody has their phones either turned off or on silent. There is a small penalty for those whose phone goes off during the course of today's events. Yet to be determined how much that might be. And in the event that we do need to leave this building for an evacuation purposes, exits are to my left here and to my right there. So please follow the crowd, to my advice. And bathrooms, for those who need them, are just behind me here, both men and ladies. At the end of today's formal proceedings, I would just extend an invitation to everybody to join us for some light refreshments and for an opportunity to carry on the conversation, to ask questions and to share the opportunity to hear more about our services. To officially start today, it's my very great pleasure to introduce Johnny Gorton. Johnny is a proud Wotjobalak man and the General Manager of the Goolum Aboriginal Co-operative. Johnny is a passionate advocate for Aboriginal people. In addition to his involvement with Goolum, over the past 20 years, he has been on the board of VACCHO, the Victorian Aboriginal Community Controlled Health Organisation, for 6 years, and is currently the Grampians Regional Aboriginal Justice Advisory Community Chair. That's a mouthful, Johnny. And a Victorian Aboriginal Justice Caucus member. He's also joined the Victorian node of the ALIGN, the Australian Alliance for Indigenous Genomics Committee. Johnny's local and state level advocacy reflects his dedication to always strive for better outcomes for Aboriginal people. And we are fortunate, as he resides here in Horsham, and that he's here with us today. And I welcome Johnny to do today's Welcome to Country.
Yeah, everyone. Dog, Mumble, Nyariniak, Johnny Gorton, Dog Wadich, Jaka Gooley, Wotjobalak. Welcome. My name is Johnny Gorton. And the land of it's good that you are here on Wotjobalak land. I initially didn't want to do this, and I want to say I'm a bit embarrassed about that stuff that gets read out about me. I don't do this for accolades and anything like that. I like to sit in the background and do the work that needs to be done. But post-referendum, it's been a little interesting for the community here. Obviously, in the state of Victoria, we had the highest no percentage. Was that a surprise to me? No. It's part of what we have to deal with when we live here. But I think I'm always a little optimistic. Like, well, I was pessimistic about the referendum. I'm optimistic about how we move forward. And part of doing this, and I thank Dr. Rob Grenfell. He's the one that reached out to me, and I've known Dr. Rob since I was pretty much a little fella. Not quite little, I was a lot younger. And Dr. Rob used to be a doctor at Goolum about 20 years ago, and that's how I met him. But I'm always optimistic about the future and how we all work together. And we've been talking with Grampians Health for quite a while, right back to before Grampians Health, how we can always get better outcomes for Aboriginal people. We have a very young Aboriginal community in Horsham and the Wimmera. So for those who don't know, the median age of Aboriginal people in the Wimmera is 25. In the last 20 years, we've lost a lot of elders, which also has a lot of cultural knowledge lost with them, which is always, one of the worst things that can happen for our community. But with a lot of young people coming through, 25% of that, our community is under 25. So we have a lot of kids in the Wimmera, particularly coming through the system, and we want to make sure that they get the best opportunities, best outcomes, whether it's health, education, and just a general, I guess, better chance at life. I was one of those kids who, people probably think it's not real around what happens to some of us when we're kids around racism and all these sorts of things, and just the lack of opportunities. And I've been quite lucky. I left school early and worked my way up. I completed year 8, and earlier this year I completed a grad cert. So I'm the only person in my family has that level of qualification. I have to admit it was hard because I had to learn things that you normally learn in year 9, 10, 11, 12. And am I proud of it? I don't feel a sense of pride, but those around me are the ones that do. And, like I said, I'm the GM of Goolum, and I started on the maintenance crew at Goolum. So it seems like a funny trajectory. How do you go from maintenance to general manager? But I never had a problem with school. If I had kept the tech school here, I might have actually been all right. But the point I'm getting to is that if all the kids that come through for our community, if they're just given opportunities and not treated second class and all those different things that, sorry, I'm going to take that off, that happen sometimes with our kids. We don't get me wrong, there are naughty kids and all that, and there's way more naughty white kids than there are naughty black kids here. So, it's unfortunate sometimes we get tarred with the same brush, but with opportunity also comes better outcomes. We have more Aboriginal people in Horsham now own their own houses than has ever happened before. So, there is some change happening, particularly for our community here. We keep working with our partners through Goolum and through the advocacy work that yourself and some of us other younger Aboriginal community members do now, because a lot of our elders don't participate anymore because they are old. And they come from a different generation. They're like the warriors, I suppose. And we don't need the warrior approach anymore, I don't think. It's got to be a little bit more tactile in how we do it. So again, thanks for inviting me today to do the welcome. I didn't know, like I said, I didn't know what I was going to talk about, so I just babbled on for the last couple of minutes. But the last thing I'll leave you with is Malagmia Mumba Warren Yakanya Una. Maybe we'll speak together again in the future. So thanks.
Good afternoon, everyone. My name is Bill Brown. I'm the Chair of Grampians Health, and it's my great pleasure to welcome you all, both in person and online, to the Grampians Health Annual General Meeting. Johnny, thank you for that very real and genuine welcome to country. Thank you, Johnny. Please allow me to also briefly express 3 further important acknowledgements. Firstly, the inclusion of a welcome ceremony is an important part of any of our official proceedings at Grampians Health. The city of Horsham is built upon land that was cared for by Aboriginal people for more than 50,000 years. And over the last 135 years, non-Indigenous Australians have also called this place home. They've worked, prospered and grown communities. However, while the history of settlement is well known, acknowledgement of what came before the 1880s is still largely unknown and either been underappreciated or were still unappreciated. Our inclusion of First Nations custom and culture at Grampians Health is not transactional or tokenistic. It is a demonstration of our understanding that First Nations people have also been left behind over time. Generations we live with now who experience unacceptable levels of poor health. Second acknowledgement is for those who are not already aware, the worldwide campaign known as 16 Days of Activism is currently underway. It is an initiative that aims to challenge violence against women and girls, and it is relevant to each of us. The tragedy is that in Australia, on average, a woman is killed by an intimate male partner every 10 days. Grampians Health aims to bring a focus to this important healthcare issue, to provide care and comfort for those who are affected by gender-based violence. I would acknowledge any survivors of gender-based violence who may be with us today. As a male, it can be difficult to accept that our gender, my gender, is the predominant violator of a female's basic human rights. But the reality is that men are perpetrating dreadful acts of violence against their partners, daughters, and other females they encounter on a daily basis. We all have, and men specifically, a role to play in changing the narrative that perpetuates sexual-based inequality. Finally, as the principal mental health provider in the region, I would acknowledge anyone joining us today who has a lived experience of mental health. We acknowledge your struggle and the stigma that is so often sadly linked to mental health, and vow to continue to work tirelessly to bring greater awareness, equality, and care to those with a mental illness. I wish also to express some specific acknowledgements today. Today, we're pleased to be joined by Robin Goolum, the Mayor of Horsham Regional Rural City Council, Sunhill Balla, CEO of Horsham Rural City Council. Thank you, Mayor and CEO, for being here. Nick Bush, CEO of East Grampians Health Service. Thanks, Nick. I saw you before. Good to see you. And also members, I won't name them all, of the Horsham Foundation, Friends of the Foundation, the Community Advisory Committee, and the Horsham Dimbulo Community Reference Group. Thank you for all being here. We've received apologies from the Honourable Catherine King, MP, Minister for Infrastructure, Transport and Regional Development, Emma Keeley, MP, Shadow Minister for Agriculture and Shadow Minister for Mental Health, and Julia Addison, MP, Member for Wendouree. I'd also like to take a moment to introduce the Grampians Health Board of Directors, who will be here later for you to chat to and ask questions of, and also just to get to know. And I ask my fellow directors to stand just briefly when I introduce you. I'm not sure where you are. I'll introduce you individually. First, Marie Aitken, who is our Deputy Chair, and Marie also chairs the Population Health and Primary Care Committee. Heather Pickard, who chairs the Board Quality and Safety Committee. Avril Hogan, who chairs the People and Culture Committee. Where's Avril? She got lost on the way?
I think she's an apology.
She's an apology, thank you. Megraj Thakkar, who chairs the Audit and Risk Committee. Anthony Shack, who chairs the Infrastructure and IT Committee. Anthony standing up the back. Rhianne Jones. There's Rhianne standing there. Dr. Nick Jones. Cora Trevathan. And last but not least, David Anderson, who chairs our Finance Committee. Each director has connections with healthcare in our community and has served on the boards of Grampians Health and the predecessor organisations that formed Grampians Health. I would like to thank each director for their dedication, expertise and leadership of Grampians Health, and for the support extended to me as chair. Thank you, my fellow directors. Turning now to something a little sadder. During the year, Grampians Health was saddened to hear of the death of a number of active and past staff members. We pay our respects to the families of the following staff and acknowledge the contribution that each of those people made to healthcare in our community. Just by the way, if there is a former member of staff that we haven't acknowledged, that's our fault. But please bring that to our attention at the appropriate time. But those I will mention are Helen Newell, Wendy Dickinson, Lindy Farrer, Suzanne Howgate, Mary Jolly, Jacqueline Blanchard, Robert Moss, and Ed Davis. Each of these individuals made a commitment to healthcare, and we honour their memories today. As we pause to remember those who have left us and reflect on what they contributed, we should also reflect on recent achievements by Grampians Health as a whole. Building on our foundation year, Grampians Health has continued to expand care options across the region. Our goal is to continue investing and developing health services, and so far we have witnessed remarkable dedication by our workforce to achieve this, resulting in growth and innovation. As the largest of the 5 campuses, Ballarat has expanded into robotic surgery, and the $595 million redevelopment of the base hospital is in full swing. Cancer care has returned to stall, along with the reintroduction of student nurses across the wards and care facilities. Dimbulla has welcomed a new campus manager, and the rural outreach team received a welcome fundraising boost. Edenhope has increased services, including community exercise and balance classes and physiotherapy. And here in Horsham, the maternity services have expanded with new birthing beds, the opening of the maternity outpatients clinic, a lactation service, and record births on New Year's Day of this year. Record births. Well done, Horsham. As we enter 2024, you will see further increases in maternity capabilities with the appointment of a Regional Director of Obstetrics. This senior medical role will be based in Horsham and greatly enhance our ability to provide increasing levels of complex obstetric care. Horsham's high dependency unit will benefit with increased medical support from our intensive care unit in Ballarat, and the addition of an on-site anaesthetist intensivist. Try saying that after a few beers. This support ensures the care of our sickest patients closer to home. That would not have happened without the creation of Grampians Health. The planning for Stawell's second operating theatre is progressing really well, and our plan is that we'll be online later in 2024. Oncology services will continue to expand across the region. Turning to research, which continues to be a fundamental component of our healthcare delivery. And over this past year, Grampians Health, which is the largest clinical research organisation in Western Victoria, has continued developing a culture where innovation is recognised. It's also valued and utilised in clinical trials and collaborations with industry, universities and other healthcare providers. Included in your information packs in the bag on your seats today is a copy of our clinical trials report. The report highlights some of the tremendous advances in cancer and cardiovascular care that our teams have been involved in. Bringing first in the world clinical advances to our region affords our community access to care at an unprecedented level. I would highly recommend the clinical trials report to you all and acknowledge the various researchers across Grampians Health who are leading us to better health outcomes. New medical models of care have been introduced with great success, including new nurse training models, home-based cancer care services, improvements to timely emergency care, and a review of how we care for patients experiencing mental health episodes, all to reduce the incidences of seclusion and restraint. As Australia's largest provider of public sector residential aged care, yes, Grampians Health is the largest provider in Australia of public sector residential aged care. We have overhauled service delivery across our 15 aged care communities to support every resident's right to live a meaningful and purposeful life. This introduction of the Meaningful Life program has already had a profound impact on those who we care for. Our consumers, whether they are residents or patients, are always our primary focus. Supporting this mission is our dedicated administrative workforce, the operational backbone of our operation. These indispensable team members play a critical role in maintaining and enhancing our services, from recruiting and managing staff, handling finances, to maintaining the cleanliness and functionality of our facilities. Their contributions are vital. Every single day, they ensure the availability of essential services such as nutritious food, organisational communications, reliable transportation, robust IT and financial systems, building upkeep and opportunities for professional growth and training. The integration of these back-of-house services under the Grampians Health umbrella has been a significant and hard undertaking, especially in terms of merging various computing systems. Problems with IT? Anyone had any of those? I want to take a moment to express my deep appreciation to everyone who played a role in this successful transition. As we continue to expand and innovate across our services, it's crucial to acknowledge the tireless efforts of these teams. Healthcare is an ever-evolving industry, and we recognise the need for continued investment in the health and well-being of our most valuable assets, our people. Over the past year, therefore, additional programs and initiatives that enhance staff culture and well-being have been introduced. Prime examples of this are the development of our Gender Equality Action Plan and the Reconciliation Action Plan. The Disability Action Plan will also be delivered in coming weeks. Our Reconciliation Action Plan outlines how we can ensure healthcare is available and accessible in a culturally appropriate way. The Disability Action Plan outlines our strategy for identifying and addressing practices which might result in discrimination against people with disability, while promoting recognition of their roles. This is imperative work to ensure that we are serving all, that is, all in our community. Globally, the healthcare landscape is evolving to meet challenging community needs, and Grampians Health is committed to embracing modern ways and means to achieve better health outcomes. I'm very proud of the creative solutions our workforce has developed in response to our historic healthcare challenges, with safe and accessible care at the heart of all change. As cross-campus teams continue to develop relationships and ways of working with each other, we continue to identify extraordinary talent and dedication. We will be celebrating many Life Governor Awards to long-serving employees this year, today, and in other places in recognition of this. Earlier this month, we passed the milestone of 2 years as Grampians Health. The first year was hard enough. The second year just flew by for me, and I'm sure many of my fellow directors. And what an immense 2 years that has been. We have laid a very, very solid foundation for the years to come. Moving forward, however, we have much more to do. We cannot rest on our laurels. The next 12 months will see us embark on refreshing our strategic priorities and our strategic plan. As the current strategic plan comes to an end, believe it or not. These strategic priorities will, however, retain a singular vision: to make healthcare for our communities more accessible. Feedback from our communities will be vital to guide the development of these priorities, and that feedback will be sought in the coming months next year. Reducing the disparity of health outcomes for rural Victorians guides our thinking every day. And today's keynote speaker will highlight regional challenges for one of our many significant issues, cardiac care, and the steps we are taking to make a difference in our region. Before I move on to the next section of the meeting, I would like to express my gratitude to our army of volunteers, consumer partners, donors and foundations for their outstanding support and generosity. You play an integral role in the success of Grampians Health, the development of our ties to the communities we serve. Put simply, we could not do what we do without you. Thank you. Finally, and to those in the community who have joined us today, can I thank you for your continued support and confidence in Grampians Health and for your trust, which we have to earn. Together, we are building a healthier, brighter future for all. Thank you. Thanks for the 2 claps. That was really great. But the first clap was well placed for our volunteers in particular. I had the great pleasure of attending a volunteer Christmas event in Ballarat yesterday, and I'm awed by the work of our volunteers in particular. Absolutely awesome work. So thank you once again.
Thank you, Bill. We now move into probably for me one of the more fulfilling parts of my job, the awarding of life governors. You will have noticed there are easels around the room that and each easel displays profiles of this year's Life Governor Award recipients from Horsham. Bill mentioned we had an event a couple of weeks ago now in Ballarat to do a similar event there, and that room was full of people who are no less deserving than the well-deserving people here today. I encourage you all to take time over a cuppa to read the profiles of each while you're at the end of the day meeting. It is likely that you have known these people or have been cared for them at some point over the past 40 years. 40 years, it's an amazing commitment to any organisation. The Life Governor Award aims to highlight the outstanding achievements and contributions made to Grampians Health by a volunteer, staff members, philanthropists, or community members. The assessment of nominations is based upon the impact that person has had on the delivery of care. And this year, we have delivery of care. In addition to today's staff awards, we have one community member that we're also going to award or make an award to. This year, the board made the decision to extend the criteria for life governors to acknowledge all staff who had contributed 40 years of service at either Grampians Health or its predecessor organisations. And across all our ceremonies this year, it won't surprise you to know that there's more than 100 people across our total workforce with more than 40 years of service. At the event at Ballarat a week or so ago, it got a little bit competitive. Some people were, 40, and then there was a 41, and then there was a 42, and I think we eventually got to a 50. So I know today we have some people in the same category. So not that there's a competition, but there will be, I'm sure. A common unifying trait of an award recipient is the humble way in which they conduct themselves. And many people don't want recognition, they don't want the limelight, they want to get on with being a great nurse or a good cleaner or whoever and just go about their day. But today is a little bit of time to focus on you. From afar, we thank them for their dedication and pay homage to their countless people that they have assisted. The Life Governor Award is our recognition of their work and a celebration of their commitment. For those who are with us today, welcome. It is a pleasure to have you here with us. And in a moment, I'll read your name and I'll ask you to come forward to receive your award from Bill. Typically in these events, the humble nature of individuals is such they want the award and they go away. But if you do want to say a couple of quick words, feel free, but please make time after today's event to to share some stories, because I'm sure you've got lots of stories to share. There will be an opportunity for photos. I'm not sure where the photo area is. Out the back there, sorry. If you haven't had your photo taken already, I would invite you to head over to the photo area down the back, where Peter will take one slightly out of focus photo and one slightly in focus photo. And somehow that'll be merged together to produce a perfect photo. So, and we'll send those photos to you just as a memento of today. And no doubt there'll be an opportunity to see yourself in Thrive over the coming weeks. Need a sheet. Okay, that's one we prepared earlier. So these are staff members who have achieved 40 years of service. Anne Russell.
That sheet, is it in your pocket?
Anne, sorry. Anne Lorna. There's lots of people on this. We'll go through everybody because they all deserve the recognition. Bruce Barnes. Bruce Gregg. Catherine Newell. Catherine Havey. Fernanda Smith, not here, but congratulations, Fernanda. Frank Markley, I presume you're doing this backwards, Frank? Aileen Baker. Graham Potter. Brenda Antonoff. Next recipient is Helen Batty. Helen Gregg. Jennifer Thompson. Gillian Roberts. Joanne Eldridge. Karen Hinch. Christina Westlake. Leanne Swartz.
You're hearing a lot of names that we all know 40 years back. It's like going back in time. Yeah.
Lynn McIntyre. Mary Wilkie. Narelle O'Connor is not here. And Pamela Marshman's also are not here, but congratulations. Susan Burns. They're quite weighty. So. Suzanne Barber. Wendy Wood. Wendy Sleep. Wendy is at 50.
Yeah.
Congratulations. Wendy King. There's a lot of Wendy's here. And our last staff award today is to Yvonne Binns. Now I'd like to invite Murray Aiken to present our final award to our community member, Penelope Manserra. Penelope is a partner at Hill Ross Financial Services here in Horsham, and she joined the Wimmera Healthcare Group Foundation in August of 2010 and is currently the Deputy Chair of the Foundation. Throughout her tenure on the Foundation, Penelope has managed the investment portfolio, helping to build the trust account from a whopping $687,000, which commenced through to a figure that now has grown to more than $2 million. Penelope and her family have been actively involved in major fundraising projects, including the kangaroo duck races on the river, raising over $10,000 each year. And prior to COVID, the Master Cook competitions at Horsham Plaza with the inaugural events in 2011 raised a whopping $50,000. Penelope is also on the steering committee for the Wimmera Cancer Centre and is a director on the board of Skill Invest. Penelope's connections to Grampians Health started early when she was born at the Wimmera Base Hospital. She went on to also have her 3 daughters at the base. Congratulations, Penelope.
Thank you very much. I think I'd firstly like to congratulate all the staff members on their wonderful contribution and long-standing contribution to Grampians Health. Got to stop thinking Wimmera Healthcare Group or Wimmera Base. So well done to the ladies and gentlemen today who have been awarded their Life Governor for their long-standing commitment. It's a remarkable effort, and I hope that the Foundation in some way throughout your tenure has helped your job in some of the services or birthing beds or etc. that we might have donated along the way. So I'd like to thank the board very much for the recognition of Life Governor. I'm very proud actually to serve as a director of the Foundation. It's I guess without saying, it's an emotional connection. I love the fact that I can help the hospital with my professional skill set, but also my strong desire to actually help and give back to the community. So it's quite wonderful. I've been very privileged to work with the current directors at the on the Foundation, who are all very intelligent, great people to work with. And I've also had the pleasure of working with a number of former directors, and especially the late Don Johns and Denise Lemberger. when I joined the foundation, Don Johns actually said to me that joining the foundation is a lifelong commitment. So I'm 46, so hopefully I've got a little bit longer in me yet to make that a lifelong commitment like Don Johns did. He certainly embodied that. I'm very proud of the contribution that Foundation has made to the local campuses of Horsham and Dimboola to help make our local hospital better for all of us, and hopefully for the staff to make their lives a lot easier at work as well. I'd just like to express my thanks and for the recognition, and I'd also like to share my acknowledgement with my fellow directors, because it really is a collaborative effort. And probably should just clarify slightly, the portfolio was 685 odd thousand. I'm not a miracle worker to make that go to 2.1 million that we stand at today. Certainly a lot of help, a lot of generous donations, and obviously markets. There's been some very big significant donations made to the foundation over the years, and one that's notable is from the Italian clubrooms when they closed down, that they donated $150,000 to the foundation. So donations like that go a really long way to helping us help the hospitals. Thank you very much.
Thanks, Penelope. And today, if any other day, is a day to acknowledge Grampians Health, Wimmera Healthcare Group, Wimmera-based hospital. I'm sure that most of our recipients here today may even go further beyond that, but the base, it would cover most of you, I would imagine. So congratulations once again to all the recipients today. You are, we are very proud to have you as staff members, and thank you so much for your contributions that you've made to our service and our community over the time. Next, I'd like to introduce Dr. Rob Grenfell, who some of you may know. If you don't know, he'll tell you. From his time as a GP in Nattymuck, and we do have Rob. Rob, for those that don't know, he's reasonably handy on the talking, so we normally get him to do a bit of our media, because he's well versed on a range of topics. But Rob serves as our Chief Strategy and Regions Officer and has dedicated his career to improving healthcare outcomes in regional Australia, and has a particular passion for improving the incidence of cardiac disease. That's not written right, is it? It's improving the ability to treat the incidences of cardiac disease. And we're very fortunate to have Rob as one of our executive leaders to Grampians Health. And over to you, Rob, to introduce our keynote. Thanks, Rob.
Well, thanks very much for the introduction, Dale, and also thanks to Pete for the AC/DC effects in the background with the feedback. And no, I'm not passionate about increasing the incidence of cardiac disease. Absolutely not. So when I was asked about ideas for a keynote address today, it was cardiac health, the silent killer that in fact actually impacts on so many people. We recently completed our population health plan for the Grampians region, and one of the startling facts in there is that we're around about 3 times the state average for cardiac outcomes. That is worse than the state average. So that gives us a base that we need to work from. So many of us in this community have actually have personal experience of cardiac disease or very direct line, and certainly many of us have unfortunately lost many loved ones and community members from cardiac disease. And, my passion comes from that personal connection as well, and the thanks to the services that Horsham Hospital was able to offer my father at the time when this happened as well. So we still have him. And so I think that's actually the important part to look at it. But why do rural communities suffer so badly? So many of us don't actually do the necessary things to actually improve our health, deal with our risk factors, but also there are a lot of people here who are challenged by socioeconomic issues as well. So access to general practice, access to all the essential medicines and health services is a problem for us in that area. And I'm sure that many of you know people who've suffered unnecessarily from cardiac disease. Now, rather than me talk about this, I'm going to play a couple of videos, and we've been very lucky to have 2 of our community members actually have a video on their experiences of cardiac disease in our area. The first is Ian Penny, a farmer from Bullite, and the second is Evelyn Holt, who lives here in Horsham. So Meredith is going to play a short video for us.
At around 5 o'clock in the afternoon, Travis, our third son, and I were servicing a tractor in the shed right here where we are now. I suddenly felt this excruciating pain right in the middle of my chest, and I knew I was in trouble then.
We'd been working together for a couple of hours. I looked over at Dad and he was starting to vomit. I walked over and I said, "What's going on?" He said, "Oh, I'm in trouble." I said, "What do you mean you're in trouble?" He said, "I've got chest pain." And he was vomiting. I said, "Righto, get in the ute." Decided to go in the Hilux. Bluetooth there, I thought it could be handy. We were about just over 30 k's from Warwick to Bill here, and I did very briefly consider calling an ambulance, and I thought, well, if this is really happening, we probably haven't got time by the time ring 000 and go through that process. So decided to take the punt and drive him in. I was pretty nervous about it, I don't mind telling you.
Anyway, we got there and I walked in, and I laid on the couch, and they gave me some adrenaline and some aspirin and a spray under the tongue, and I don't remember a lot from there on. Dr. Franklin, and he had his nurse Debbie with him, they were both fantastic. I can recall saying to Dr. Franklin that I'm having trouble lifting my arms, I've got no strength in them, and then I just died. And the next thing I recall was Lorraine was standing by my side. She'd got the message to come down to the surgery, and she was rubbing my face, and I said, "I think I've had a little sleep," and I obviously did have a little sleep. So apparently I had the paddles on me. I woke up with a sore chest because Franklin had obviously given me a fair pounding to get me going again. The decision was made to try and fly me to Ballarat, and the weather was so foul that night that they didn't want to fly.
If we probably look into getting a defib out here, I reckon it could help someone or in our own family or a neighbour or anything that could be around here. Yeah, so it's certainly worth looking into. So.
But the main message is that I honestly didn't have any real symptoms. I've never had a cholesterol problem. I've had blood pressure problems since I was about 50. I'm 76 now, and but controlled by medication. On the Monday previous to this happening, I had a dull pain right in the middle of my chest, probably about 4 o'clock in the afternoon. And I get a bit of indigestion because I like highly seasoned food, and I thought that's what it was. Went home and had tea and it had gone, didn't even think any more about it. But obviously that was a sign that I didn't realise what was happening. And I think the message is that to anybody who may be experiencing something like that, a change in their body, to be aware of it and certainly get it checked out.
I was around about 10 or 11 when they said I had the heart murmur, but nothing happened from the whole time at that age. I was 39 years old when I just could not get enough sleep, or I was getting pains in the chest and I was losing my breath all the time. So I went to the doctors. They checked me out to see because they thought it was chronic fatigue, but it wasn't chronic fatigue. They found out it was an enlarged heart. After they did the tests on me, had to do the stress test, the walking test, everything like that to find out. They did an ultrasound on my heart. That's when they found out that I actually had the problem with my heart. And they decided to put me on medication. About 40 years old, they found out I was a type 2 diabetic as well. So I was doing a lot of pricking with the warfarin, plus with the type 2 diabetes. Now I hate needles. I really hate needles. But I moved to Horsham in 2017. I was under Dr. Wimmera, my doctor, before he passed away, at Lister House. It was mainly him checking on me and everything. I never got to see another cardiologist doctor or anything like that until I had my problem, and I landed up in hospital November last year. And that's when I got to see my cardiologist, Dr. Rajiv. I had continuous pain in my right side of my abdomen, right? And it got to the stage where I could not handle the pain anymore, so I ended up going to the Wimmera hospital. Dr. Rajiv is fantastic. He explains everything that a lot better than most of the doctors do on what he wants to do and what he wants to see and how things are going with me. And when we couldn't get to see each other, we did a phone call constant, and he was really interested in wanting to know everything that was going on, if I was getting any pains, and because at one stage I was just collapsing for no reason, and Dr. Raji actually found out it was one of the medications that I was on, because I'd been on it for so long. It wasn't doing what it was meant to be doing. It was just slowing everything down and causing me to go down. I'd be walking down the street and then all of a sudden, bang! So I have to thank Dr. Rajiv for a lot of things. So.
One of the most important things is that patient journeys are actually the core to the care that we actually provide at Grampians Health. And in fact, actually, the reason why we all come to work, I think you'll all attest to it, is to in fact actually look at how we can actually engage with these journeys and make sure that they have access to the highest possible care that they can have. Unpacking slightly some of those videos, there's a couple of key messages in there. Is one, know your risk. Know your risk factors, get your risk factors checked. But the warning signs of a heart attack, having my time as a GP in this area, that Ian's story is just far too similar. And during the time of harvest, the number of people that actually stay on the tractors and on the trucks before they in fact actually come in for anything, simply because of the fact that they've got to get the harvesting because it's going to rain. That's more important than living, apparently. And the other part of that is the silence that occurs with women and heart disease in the community as well, which is one of those travesties. And you'll see from the Heart Foundation, the Go Red for Women is trying to get the idea women actually suffer from heart attacks as much as men, and the idea of actually not ignoring. And as we saw in the last one, bizarre symptoms, pain in the belly, stuff like this. So, if you're not happy, get it checked up. That's probably the advice I can give. Now, great pleasure in introducing Dr. Rajiv, who's now famous from his video endorsement. Now, Dr. Rajiv is a comprehensively trained cardiologist, and we are so fortunate to have his services in our region. The clinical services plan identified the need to start cardiology services here and at the Horsham campus, and we're grateful that Rajiv answered that call. And he visits Horsham each fortnight, and additionally from Ballarat he supports, as you saw, by video conference and others through consultations. So I'll ask Dr. Rajiv to come up and give us a talk about some of his wisdom on cardiac disease. So Rajiv, thank you.
Very good afternoon to everyone. I'm honored and privileged to be part of this meeting. I would like to thank the organizers at Grampians Health for having me over here and giving me this wonderful opportunity. And also today happens to be a very special day for me because I've completed 1 year at Grampians Health. It was exactly a year ago, on the 29th of November 2022, when I started working at Grampians Health. So today is definitely a very special day, and I think I'm really proud to be here. Thank you very much, Johnny, for a wonderful welcome to the country. I'm also grateful to Ian and Evelyn for sharing their stories. And thank you, Rob, for your kind introduction. For the next 15 to 20 minutes, I'll give a brief overview of heart health statistics in Australia, the common conditions which we see in our day-to-day practice, the risk factors predisposing to these heart ailments, and the work which we are currently doing at Grampians Health, particularly at Horsham, to tackle these heart ailments. This is a brief introduction about my training as well as experience. I have completed my basic medical training, physician training, as well as cardiology training from India. I worked there as a specialist cardiologist in a public teaching hospital for close to 8 years, before moving to Australia. I've also gained experience working at National University Hospital, Singapore, between 2016 to 2017. I moved to Australia in 2019, where initially I underwent a formal fellowship in cardiac MRI. After that, I've been working as a cardiology consultant in South Australia, mainly serving regional areas like Mount Gambier. And then late last year, I moved to Grampians Health. I'm a member of various medical societies. My areas of interest include acute coronary syndrome, in layman terms, what is called as heart attacks, as well as imaging of the heart, in particular cardiac MRI. I've authored several research publications, abstracts, as well as book chapters. So now I'm going to go through some of the common heart conditions which we usually encounter in clinical practice. I think a couple of examples have already been previously shown in the e-video by Ian as well as Evelyn. The most common heart condition which we see in clinical practice is blockages in heart arteries. So whenever there are blockages in heart arteries, there is compromised blood circulation to the heart muscle. And usually such individuals manifest chest pain, especially on exertion. As illustrated here, these blockages usually happen due to cholesterol deposition in heart arteries, usually in the presence of a number of risk factors like smoking, diabetes, and hypertension. The next most common condition which we treat is disorders of the heart muscle, commonly known as heart muscle disease or cardiomyopathy. So this can affect either the squeezing function of the heart or the relaxation of the heart. And they usually manifest with shortness of breath on exertion, as well as swollen ankles. As all of you are aware, we have 4 heart valves, and diseases of the heart valves are common as we age. Issues arise whenever there is excessive leakage or significant narrowing of the heart valve to compromise the blood circulation. Also, all of us have what is called as wiring system or electrical connections within the heart in both the upper chamber as well as the lower chamber. So any short circuit within the electrical system can result in fast heart rates, irregular heart rates, as well as heart flutters. As we age, the electrical connections tend to get worn out. This is when people start having trouble because of a slow heart rate, and they usually manifest fatigability or even blackouts. So these are the usual conditions which we come across in our clinical practice. I'll also just mention about a couple of other conditions which are quite uncommon. One is diseases which are present since birth. That's because of a developmental abnormality within the heart called as the congenital heart disease. We don't see them very often. And the other one is diseases affecting the covering of the heart, that is called as the pericardium. Now, I would like to spend some time on this slide regarding the heart statistics from Australia. So this data is taken from the Australian Institute of Health and Welfare. In 2021, 5.1% of all hospitalizations were related to abnormalities of the heart as well as the circulatory system. In this data, there was a 40% higher chance of being hospitalized with a heart ailment for individuals living in remote as well as very remote locations. So this is something which we need to consider seriously and something which we need to work on so as to reduce the burden of heart ailments in remote and very remote locations. In 2020, there are around 56,700 adults with heart attacks. So if you calculate it, there is an Australian having a heart attack every 10 minutes. And in this data, I'm sorry to say that 12% of the heart attack events were fatal. In 2019, heart-related and circulation-related ailments were responsible for 25% of all the deaths, and heart muscle disease or heart failure contributed to 15% of all deaths in 2021. So heart disease is really a major problem in Australia that needs to be addressed. In 2019-20, an estimated 9.1% of the total expenditure in Australian health system was towards heart health. The high allocation towards heart health signifies the burden of heart disease in the Australian community. The maximum allocation was to blockages in the heart arteries, as well as irregular heart rates, as well as heart flutters. So what is driving the increasing number of heart ailments among Australians? In a broad sense, the risk factors for heart disease have been divided into those which can be modified and those which cannot be modified. Up to 75% of heart ailments are due to modifiable risk factors, which can be either be behavioral or biomedical risk factors. I'm sure all of you in the audience will be aware of these risk factors, but it's still worthwhile to go through them. First, cigarette smoking. So this is the most common risk factor implicated in development of heart attacks. Any form of smoking, either active or passive, even vaping, is harmful to the heart. Smoking increases blood pressure and also damages the lining of the blood vessels, predisposing to clot formation within the heart arteries, as well as the circulation to the brain. So this results in heart attacks as well as strokes. In the current era of technology, iPhones, laptops, name the gadgets you want, where we have most of the things at our fingertips, I think our physical health is taking a backward step. We are moving around less, and lack of physical exercise results in fat deposition within the heart arteries, leading to blockages. The next one, excess consumption of alcohol leads to weakness of the heart muscle, as well as predisposes to irregular heartbeats. I'd also like to point out recreational drug usage with either cocaine and amphetamine can also lead to heart attacks as well as heart muscle damage. Regular consumption of junk food as well as fast food predisposes to premature heart disease. It's also important to note that it's not just the consumption of junk food, but lack of fruits and vegetables predisposed to blockages in the heart artery. As you can see, these behavioral risk factors contribute to a significant proportion of heart ailments. It's very easy for a GP or a doctor or even myself to advise the patient and give a lecture about these risk factors. But in reality and in practice, it's very, very challenging to modify these behavioral risk factors. So as the saying goes, old habits die hard. Next, coming to the biomedical risk factors. Having high blood pressure, having high cholesterol numbers, as well as high blood sugar results in problems with the heart muscle function, as well as predisposes to blockages in the heart arteries. Being overweight or obese places a significant stress on the heart muscle and is also one of the common risk factors or predisposing factors to high blood pressure, high blood sugar, as well as abnormal cholesterol numbers. Although I've not mentioned here, I would like to talk about the implications of psychosocial factors on heart health. It has been shown that anxiety, depression, lack of social support all predispose to heart diseases. I'm sure all of you would have heard about the broken heart syndrome, where there is stunning and weakness of the heart muscle whenever an individual is exposed to acute severe stress. The triggers for stress could be either emotional or even physical. So as you can appreciate in the last two slides, the biomedical risk factors as well as the behavioral risk factors are strongly related and interlinked. Just to give you an example, lack of physical exertion or lack of physical activity coupled with unhealthy eating habits will obviously be a risk factor for being overweight and being obese, which in turn increases the risk of one having high blood sugar, high blood pressure, as well as cholesterol numbers. So all these are very closely interlinked. So what are we doing at Grampians Health to address the heart issues in remote locations as well as very remote locations? With the help of the organization at Grampians Health, with guidance and support from the Department of Cardiology at the Ballarat Base Hospital, as well as the physician support here at the Wimmera Base Hospital under Dr. Chris. We have commenced cardiology services from early this year. I'm visiting Horsham on-site every fortnight for ambulatory care. I also offer telehealth consultation services from Ballarat to patients in Horsham on a regular basis. I'm also regularly in touch with the physicians at the Wimmera Base Hospital, and I provide support and advice to cardiac patients who are admitted here. We also provide 24-hour blood pressure monitoring services, as well as 24-hour monitoring of heart rate and heart rhythm. We also have good community programs here at Horsham, like cardiac rehabilitation, as well as chronic heart failure or heart muscle disease program. We have a very good team of trained nurses, exercise physiologists, physiotherapists, dietitians, as well as social support workers who are more than happy to help patients once they're discharged from the hospital and also take care of individuals having heart muscle disease. So this is just the beginning. Over a period of time, we plan to slowly expand our services both at Horsham as well as Ballarat. At Horsham, in the coming years, we are trying to get echocardiography services running soon at the Wimmera Base Hospital. As all of you are aware, echocardiography is nothing but an ultrasound scanning of the heart to check out the heart muscle function, as well as look at the heart valves and their function. And this is a routine test which is done in all individuals with either suspected or proven heart disease. Also, many individuals suffer from chest pain, and it's extremely important for the treating physician or the cardiologist to know whether the chest pain is related to a reduced blood supply to the heart muscle or not. For the same reason, the usual test done is an exercise stress test, where we put the patients on treadmill. We ask them to walk for a certain period of time, monitoring their heart rate, blood pressure, as well as the ECG, and look for any changes in the ECG which could potentially suggest a compromised blood circulation to the heart muscle. As I stand and speak here today, I'm happy to let you know that we have just had the exercise stress test machine delivered here to Horsham, and hopefully we should kickstart the service early next year. By coordinating with the anesthetic team as well as the general medicine team, we are also hopeful of providing cardioversion services here at Horsham. Cardioversion is a simple procedure where we deliver a low intensity shock to the chest wall to rectify irregular heartbeats or heart flutter. So it's basically a procedure which restores your heart rate and heart rhythm to normal. We're also considering expanding our support staff services, as we need the help of advanced nurse practitioners as well as on-site cardiac pharmacy support for heart patients here at the Wimmera Base Hospital. I think our work is not complete until we have comprehensive data about the heart health in regional places like Horsham and surrounding regions, because the data which we have locally is going to be a platform for future policy decision as well as administrative decisions. So I think it's extremely important to focus on cardiac research in regional areas. Now, given my expertise in cardiac MRI, the cardiology department at the Ballarat Base Hospital is very keen to consider starting cardiac MRI services. We have had preliminary talks with radiology team at Ballarat, and they have been very supportive. Hopefully, in the near future, we are going to start cardiac MRI services, which is definitely going to benefit Grampians Health. The indications for cardiac MRI in day-to-day clinical practice is rapidly expanding, and it will be a very useful tool to offer to the population at Grampians Health. So to conclude, heart diseases are the single leading cause of disease burden and mortality in Australia. As I mentioned before, heart diseases are preventable. Even if some heart diseases are inevitable, they can definitely be postponed with control of risk factors. And as mentioned before, many of the risk factors are modifiable. Over the last 12 months, I've been seeing that Grampians Health is striving very hard to serve communities across region and across specialties. From a heart perspective, we're hoping to deliver timely basic services in remote and very remote locations, and hopefully expand our facilities in future. If there is one take-home message from my talk today, it would be about the 10 steps to protect your heart, as recommended by the Heart Foundation of Australia. So my suggestion is anyone more than 40 years, even if you feel perfectly well, even if you don't have any symptoms, please see your GP for a heart health check All of you should know your numbers, know what your blood sugar levels are, what your cholesterol numbers are, what your blood pressure levels are. And if there's any abnormality, please follow the advice of your doctor and get it treated and keep it under check. Also, always follow a heart healthy eating pattern and adopt healthy lifestyle choices. So to conclude, I would say, please don't take heart health lightly and take maximum precautions to avoid any cardiac ailments or cardiac catastrophes. Thank you very much for your attention.
Thank you, Dr. Rajiv. That was gives us a lot to consider in terms of how we can improve our heart health. Very much to consider. It's great to have you here today, and thank you for sharing how we will be continuing to improve cardiac care in Grampians Health and your very clear and fundamental role in making that all happen. So thank you again. I'd also like to thank Ian, Travis and Evelyn for sharing their experiences in the videos. I can't imagine how frightening Ian's experience would have been, not only his, but Travis's as well. And I'm very glad that Evelyn is realising the benefits of Dr. Rajiv's employment here at Horsham. In fact, we've included cardiac care information. I'm not sure if the circle is in the pack, but there's material in the bags on your seats. And we ask you to take some time to read those. There'll be definitely some learnings in there for all of us. The bags, they also include a copy of our annual report, our new research booklet that I referred to earlier, information on how to get involved in the 16 Days of Activism campaign, which I mentioned earlier, and every person in the room, and particularly every man in the room, should do so. The latest Horsham newsletter, not newspaper, we're not in the publishing business, it's our newsletter that goes out, and a survey that we'd really like you to take some time to fill out. It's asking you to identify areas of service expansion that you think are required for the Grampians Health Horsham population over the next 15 years. Your feedback will be important and it will help us. For those online, you can access all these materials on our website. Well, and you'll be glad to hear that brings to an end today's formal proceedings. Thank you once again for joining us, whether in person or online, and for your interest in Grampians Health. If you want to be kept informed on what's happening around our campuses, I encourage you to follow our social media accounts, the socials, as my grandchildren talk to me about, or you can visit our website for regular updates. For those in attendance, I would now like you to invite you to join us for some refreshments and conversation. Refreshment-wise, there's a mixture of food there, Dr. Rajiv. There's some good and there's some really good. So everything in moderation. But please join us for the conversation. That's the main part. That 9 out of 10 directors are here, and most, if not all, of the executive team are here too and would love to chat. And don't forget as well to look at the easels around to learn a bit more about the Life Governors. And for those of you online, thank you, and everyone, good afternoon. Thank you.